President, I rise today on behalf of 18,000 Nebraskans who have contacted me to express their concerns with the negative impacts of Obamacare. Rather than addressing these problems in last night's State of the Union address, the President doubled down on this failed policy. The President had his chance to speak, and now I believe it's time for my constituents to have their voices heard. The law, Mr. President, is hurting my constituents. It's hurting middle-class families. We now know that millions of Nebraskans have lost their private health insurance. Many who have successfully enrolled in the exchange have been forced into plans that don't meet their families' needs. These plans often cost more, but it covers less. Treatments, even for those battling cancer, have been delayed. We learned this month that a woman named Josie, who was diagnosed with breast cancer, recently lost her doctors. She was forced to postpone her scheduled biopsy and follow-up treatment. The reason? Josie's insurance rolled over into a new plan in the exchange under Obamacare at the start of the new year. Seniors are losing their trusted doctors too. Americans are disclosing deeply personal information, including their health care histories and their social security numbers, to this flawed website that is ripe for hacking. If truth in advertising rules applied to Obamacare, it would be banned as an unfair and an unreliable product. Let me give you an example. We were all told that this massive law would dramatically expand coverage for the uninsured. Yet a recent Wall Street Journal article cites a McKinsey study that undermined this promise. Quote, only 11% of consumers who bought new coverage under the law were previously uninsured, according to McKinsey & Company's survey of customers thought to be eligible for the health care law marketplaces. One reason for people declining to purchase plans was affordability. That was cited by 52% of those who had shopped for a new plan but not purchased one in McKinsey's most recent sampling performed in January. As it turns out, the Affordable Care Act is hardly affordable. And the vast majority of those who purchased insurance through the exchanges already had health insurance. Last week, the CEO of Aetna, a major insurance company, said Obamacare was not attracting enough uninsured people to work. He said more premium increases are on the horizon. Are they going to be double-digit, he said, or are we going to get beat up because they're double-digit? Or are we just going to have to pull out of the program? And recently, Moody's downgraded health insurers from stable to negative based on the uncertainty related to Obamacare. The downgrade is a result of the administration's series of unilateral changes which only invite more uncertainty. This pervasive uncertainty is also plaguing our small business owners who are struggling with the onslaught of new regulations. Americans see selective delays for some, but not for all. Hardworking men and women, our entrepreneurs, are the backbone of our economy. Any sort of meaningful economic recovery will only come when they have the confidence to grow and expand their businesses, and that requires certainty. Obamacare robs them of that certainty, and as a result, the unemployed are robbed of jobs. It's not just those searching for work who suffer from Obamacare's heavy regulatory hand. Our senior citizens are at a loss as well. The Washington Post recently described challenges facing Medicare Advantage patients because of Obamacare. Obamacare has cut over $500 billion from Medicare, and now insurers are terminating physician networks. According to the Post, insurers say they must shrink their physician networks because they face billions of dollars in government payment cuts over the next decade, reductions that are being partly used to fund insurance coverage for millions of people under the Federal Affordable Care Act. And it's not just our seniors, it's also the young. A recent study by the American Action Forum found that it would be cheaper for 86% of young adults to forego coverage. The study concluded, and I quote, "Even after the mandate penalty is fully implemented, a majority of young adult households will find that it is financially advantageous for them to forego health insurance, pay the mandate penalty, and personally cover their own health care expenses." Without the participation of the young, healthy people, we are told the whole system will collapse. Then what? Well, to add insult to injury, some Obamacare proponents want taxpayers to pick up the tab for insurance companies, assuming that the whole system might, in fact, collapse. Instead of calling this a bailout, which is what it is, they use terms that could only be coined in Washington. Terms like risk corridors, reinsurance funds, or risk-sharing protection. The White House may even preemptively alter portions of this program for big insurance companies before the law falls apart. I believe Americans have paid enough. That's why I have co-sponsored Senator Marco Rubio's Obamacare Bailout Prevention Act. The president and big insurance companies should not be permitted to force taxpayers to pay for the mess that they created. Nebraskans have no interest in any more bailouts, and they certainly cannot afford to pay for these skyrocketing premium spikes. Just ask my constituent from Lincoln who wrote me recently to share her story. She said, "I spent 2 hours on the phone with healthcare.com. The supervisor said she was going to try and reapply and reinstate my plan beginning January 1st, 2014. After an hour-long process, everyone but my 15-year-old son was approved for health care. So then she tried to apply again. An hour later, the system crashed, and she asked me to call back later. So I called back yesterday. I had to go through an hour-long process again for signing up. At that point, all 3 of my children were completely denied coverage. My husband and I are seriously scared. If something catastrophic happens, our family will be ruined without health care for our children." These hard-working middle-class families need relief. They are overtaxed and overburdened. People are scared. The law has not brought what the president promised. The cost of this flawed law is depriving Nebraskans the opportunities to build their own futures and pursue their own dreams. Scrapping this law should be a priority for the Senate, the White House, and for the country. It is certainly a top priority for me. We must repeal and replace this law now. Anything short of that is irresponsible. Our constituents are counting on us. Let's not disappoint them. Thank you, Madam President. I yield the floor.